Hello, Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Today we're going to talk about neurological disorders. What is neurology? Many people get confused with exactly what domain and what area of the body specifically we're talking about. And we're going to talk about the things that come into this with health concerns. And for today's program, we have with us our expert. We're very happy to have here to join us Dr. Husnain Hashim, who's a consultant neurologist and stroke specialist. Thank you very much for joining us here today.
Thank you for inviting me.
Okay, so while we're talking about neurology, we may find that many people are sort of confused as to what falls within that domain. What exactly are we talking about?
Neurology is, you can say that it's a branch or subspecialty of medicine that is related to brain disorder. And but unfortunately, the people are aware about the neurosurgery and psychiatry and neurology or neurological disorder. Usually they are being divided between these two specialty, and people doesn't much know about that neurophysician, that it's separate specialty from the neurosurgery. So it's very important to know that neurology is one of the biggest subspecialty of the medicine that has multiple subspecialty or multiple disorders that, and now people are doing even 1 to 2 year fellowship in different diseases like epilepsy, stroke, movement disorder, and neurodegenerative disorder. So this is a very wide field that, and unfortunately people are not aware about these fields, that they comes under the umbrella of neurology or neurological disorder. If we talk about the main category of the neurological disorder that comes under neurology, is stroke is one of the biggest field, and we know about the span of stroke or stroke related disorder is very wide in Pakistan. In addition to the epilepsy and epilepsy related disorders, so they are also very common and in our society and all over the world, and most of the people doesn't know about that this should be managed by the physician or neurophysician. So people are going to again to the other doctor or neurosurgeon or psychiatry doctor. In addition to that, there are many disorders that are related to muscle diseases, muscle weakness, your nerve problem, and in addition there's neurodegenerative disorder like Alzheimer's disease and Parkinson disease. So nowadays these are also categorized as subspecialty of neurology, and itself there are many other subtype of all these disorders. So it's I can again say that it's very wide field, and we unfortunately, even in Pakistan, the qualified neurophysician are only 150.
Yes, that I was going to ask you that.
About 200 million population, only 150 neurophysician, and only they are congested to the big city, like 4 or 5 city, and rest of the all even big city and periphery without any neurophysician. So that's why we don't have any proper awareness about the neurological disorder, and we don't have any guide about that one, and neurophysician not available. So these disorder are underestimated or mismanaged or not properly being referred to the proper neurophysician.
Okay. Now, my question is this, that because you are a neurophysician and you're a consultant neurologist, so you're seeing these cases every day, how many people come to you when they have missed the signs of a stroke? And you've been telling them that, and you've been wishing that there was more awareness and people would understand how important it is to act quickly. How many times has that happened?
I think it's a number of times, because for the last 5 months that I came from abroad, and I'm seeing a lot of patients that they are mismanaged or they are not properly referred or seen by a neurophysician and on the time. Though I know everybody knows that nowadays for the stroke, especially if it's due to the blockage of the vessel, there are many treatments are available. Like we have injection that a patient comes within 4.5 hours and 4.5 hours to some specific stroke center where you are giving that kind of injection, that is clot busting injection, that is called alteplase. That is now we have started into hospital in Pakistan, but soon it will be available in government hospital. That is very blessing for the stroke patient. If you give that within time window period, stroke patient usually will see that within few days patient will be able to walk, that paralyzed patient. So So these patients, there are many patients that we are seeing that they are maybe coming after 24 hour, after 48 hour to the proper stroke center or neurology department. By that time, they usually they're full of complication and
What are
doctor
those
usually
complications?
complication that there's swelling of the brain, there's complete paralysis, we cannot do anything. They develop aspiration pneumonia, they develop a lot of other things like fever and a lot of other infection.
Right.
So these patients at that time, it's very difficult for the neurologist or stroke specialist to do anything except for rehabilitation or maybe secondary prophylaxis that we can give aspirin or we can prevent. Or
So in other
investigate.
words, the damage is done.
The damage is done that we cannot bring it
And
back.
you just have to manage that now.
Yeah,
Okay.
exactly.
So Dr. Husnain is saying that, you know, if somebody is having a stroke, it is very, very important for them to get to a proper medical facility and have the proper treatment within, you said, 4 to 5 hours? Is it?
4.5 hours.
4.5 hours. Very, very important. So, Dr. Husnain, tell our viewers what are the symptoms and signs that someone is having a stroke?
It's very easy. I think there is a, for the general public, it's very easy to recognize stroke symptom. If they have like facial droop or any deviation in the mouth within sec, that occurs within period of minute and second, any facial droop on one side or any arm weakness or numbness on one side or there's leg weakness or any mild paralysis on one side.
Right.
And third thing, if you feel any difficulty in talking or unable to speak. So these
Okay.
are the symptoms that if you have any one of this one, so you should not wait for any, you should not go to any GP or any other physician. Immediately try to find the best stroke center
Right.
that you think so that stroke facility is available and you should go to that rather you're wasting your time.
Okay.
So these
Time
are the
is very
cardinal features
important,
that facial
yeah.
droop, weakness and arm or leg, and third is the speak difficulties. These are common finding that everybody can recognize.
Right.
And another thing is that I think that most of people, they are we are seeing many patients being referred to the cardiology center if they have stroke, and because stroke also causes some pain and
In your-
paresthesia on arm
right,
and leg.
on one
So
side.
when they have weakness and some pain on that side,
They
so
think
people
it's-
ignore weakness and oh, this is the heart pain or something else. So they usually they go to the cardiology center.
Okay.
Like many patients are being referred to the Rawalpindi Institute of Cardiology with a stroke symptom, and they refer to some PIMS hospital or Shifa hospital.
Okay.
So people should know that weakness, any deviation on the mouth or any difficulty in speak is not a heart disease, it's a brain
stroke.
disorder, it's stroke, and they should immediately bring these patients to the certified
place.
proper stroke center.
Okay.
Currently, that medication that is available in Shifa hospital, that injection that we are giving to that patient.
Is
and
that
in
very
addition to that,
expensive? Is it very expensive?
it's like 150,000, like 150,000. It's not, and we are trying our best. Our society is trying our best to bring the cost of this injection to less than 1 lakh or half of this, and
Yeah.
it will happen. And soon it will be available in a government hospital. And there's also another treatment that Shifa has also started, and it's available in all over the world in good stroke center. That what we are doing in patient with the heart attack, that with angiographically we can remove that clot. Okay, this
okay.
called mechanical thrombectomy. That with any good radiologist that is expert in removing that clot through angiographically, that remove clot within 6 hours. So this is an also treatment that is being used for those patients who present with these stroke symptoms within 6 hours to the stroke center.
Right. Dr. Husnain, tell us, who are the people most at risk? Who should be watching out for the...
Yeah, there are many risk factors. Okay, we can divide into modifiable or non-modifiable risk factor, like diabetes,
Right.
hypertension. Hypertension is considered in all over the world the most common risk factor for the stroke and heart disease, followed by the diabetes, cholesterol, and obesity, and sedentary lifestyle. And these are the main common, and smoking as well. These are common risk factors that are modifiable. We can modify with the with our lifestyle modification.
Right.
But in addition to that, there are other risk factors, like growing age is also a risk factor.
Okay.
You can see that old people are having more stroke as compared to the young people.
Right.
Gender itself is a risk factor, like, as a male gender is more prone to develop stroke as compared to
Okay.
that. And other thing is like genetics. we cannot change, though it's not genetically proven, but if you have family history of hypertension, diabetes and stroke, it's very rare, but still these cannot be changed. Okay, but rest of the modifiable risk factor we can change with the proper management and all these things.
Right.
So
Having said that, a person, say they have diabetes, hypertension or whatever, or a person who does not have any of these diseases, what should be a preventive lifestyle?
yeah, so I would like to ask, especially the people who are young, they should have active lifestyle. They should stop smoking immediately.
Stop
This is one of the. They should have active lifestyle, sedentary lifestyle, that always sitting in front of me, like on desktop and all these things. They should avoid all these things. In addition to that, weight gain. They should properly check their weight and should not increase according to. And there is an index like bone marrow index, the BMI index. It should be less than 24, 25. That is ideal for your height and your weight.
Right.
So this is very important.
They should be sort of like indulging in physical activities, exercise.
Weight reduction and physical activity and active lifestyle. This is very important.
Is just going for a walk okay for losing weight as well?
It's a usual walk. If you are walking for, maybe it's brisk walk is very important for at least 30 minutes, 5 days a week.
Right.
And this is very recommended.
Right.
And if you can do more than that, that is okay. But at least 5 days a week, 30 minutes at least, this is recommended. And in addition to that, your diet is very important.
Okay.
Like oily diet full of cholesterol, and if you should reduce the sugar consumption as well, because we don't care about the sugar consumption. And in addition to that, the consumption of rice and chapati, because they contain a lot of the weight gaining material, so we should avoid this one. In addition to that, a lot of consumption of the food, vegetable, and this fiber diet. This is recommended. And
fruits as well.
Fruit. And these are both are good for the stroke patient and for the heart disease.
Okay.
Because the prevention of the stroke and the heart disease are almost same.
Right. Okay. So tell us about this. That is this something that is sort of, are demographics involved here? Do we find stroke patients in a particular part of the world? Or is that not a factor there? And also, are we seeing younger people presenting with strokes as well?
Yeah. Currently, statistics are showing that with the passage of time, many studies have shown that people who are in young age, they are having a stroke very common. They have a lot of different risk factor. Like sometimes they have some vasculitis, like, and there's some deficiency in their blood, like a certain kind of protein and certain kind of material that is, you can say, that make the blood more thick. That is found in more young patients. We can find, and we have to treat that one.
Okay.
In addition, heart diseases are very common in young populations. Like maybe there's a transient irregularity in a heart rhythm. In addition to that, if the patient has developed any rheumatic heart disease in the childhood, they are prone to develop this maybe in the later on heart diseases. And sometimes clot from the heart can go to the brain, and that is one of the big reason for the stroke. So heart disease is also common in young patient with stroke.
Okay. Tell us about stress. How much is stress affecting neurological disorders?
Exactly. Stress is not directly but indirectly responsible for many things related to stroke. If you have stressful lifestyle, it can increase your blood pressure. It can increase your it can impair your sugar level. Stress is also related to your weight gain. Stress is also disturb your lifestyle. Stress also disturb your sleep pattern. So stress indirectly affect many things. Okay, that are indirectly related to the stroke incidence and heart diseases.
Right.
For example, due to stress, if your like sleep hour are not complete, that will also increase a lot of other things like blood pressure rise and other things, and that is also responsible for the stroke as well.
Right.
So indirectly, stress is related to the increased incidence of stroke.
Dr. Husnain, tell our viewers, because we see many times that people are, not really paying much attention to the amount of sleep they should have themselves or even their children. Tell us, sleep on general well-being, and especially in neurology as well. How much does that affect a person?
Yes, sleep is very important. Studies have proven that 6 to 8 hours sleep a day is recommended. If you sleep less than 6 hours, it will be responsible for many disorders. So migraine, for the stress, for increased instance of stroke, agitation, depression, and all these things. So these are a reason for the lack of sleep. And next day you will not be able to fully concentrate. There are a lot of any concentration issues. You cannot fully give attention to your work. So these are related to lack of sleep. If you and a few studies have proven that if you sleep more hour, like 8 hour or 10 hour, though that they increase the incidence of maybe certain diseases.
I see.
Like a stroke. It's a few studies, but it's not
sleeping too
recommended.
much.
Ideal
6
sleep
to
is
8
6
is-
to 8 hours, very ideal. 6 to 8
Okay.
hours is very ideal.
Right.
From
Okay.
neurology point of view.
Right, fine. So you mentioned migraines. That brings me to another question. There are different types of headaches, and for a person who's having a headache, everyone is severe to them. How do we differentiate between a migraine and another?
Migraine is have very specific sign and symptom and specific criteria to diagnose.
Okay.
And especially one thing that migraine is common in young population. It's very prevalent in female.
Okay.
Almost 35 to 40% of the female all over the world, they are having migraine, especially
Okay.
young population. And about 8 to 10% of the male people have migraine. So it's a gross difference is there. If you have episodic headache, not continuous headache, like maybe once a week or twice a week, or and it's unilateral. It's pulsating kind of headache that's like your pulse, and it is associated with nausea, nauseated feeling, vomiting, or there is photophobia, like light will, it's more like pinching in your eyes.
Okay.
And the fourth one is phonophobia, like you're just this any sound kind of sound is very damaging you. So these are cardinal part of that migraine disorder.
Right.
So it's episodic, like coming and going, and this one is pulsating on one side, and nausea and vomiting. These are common feature of. In addition to that, there are other features like flashes of light in your eyes.
Okay.
There are transient numbness on your on one side of the body, and sometimes there is speaking difficulty. But they are very rare.
Very
And as you mentioned that there are many type of migraine. So there are many. For example, there is a type of migraine where you feel only vertigo or abdominal pain as well. So it's very, but the classical symptom that I told you that only one-sided pain, unilateral, nausea and vomiting, and this is only type of headache that is related to your lifestyle. It's related to your life. If you sleep less than 6 hours, migraine will come. It is related to your irregular diet schedule. If you miss breakfast or a dinner, most of the migraine patient can have this one.
Okay.
And the third thing is that is your screen exposure. If you're office worker
that's very
or
important.
using more time in front of the TV, laptop, computer,
Phones.
mobile, phones, if you're especially the video or changing lights. So these are responsible for the migraine patient. And hectic lifestyle, physically or mentally, like you're working more than 12 hours a day without giving any rest. So these are the factors that are responsible for increasing incidence of migraine. So for migraine patient, first of all, they should take care of all these factors. They should
That are triggering.
exactly the trigger. But otherwise, the etiology of migraine is still not known. There are certain theory, but still exactly what is etiology is not proven. So that's why many medication with different mode of action, they are being used and have different effect there. But most of the migraine is in hand of the patient. If, for
Okay, it's
example,
how they're managing
how
their
do you manage your
lifestyle.
lifestyle and how
Okay.
can manage your schedule, most of the migraine you can treat without going to the doctor, only with one pill of paracetamol or brufen.
Really?
Really.
That
You need to go to the doctor when it's very frequent, disturbing your job, disturbing your study, or having maybe in a month 3 or 4 times. Then otherwise,
Right.
once a month migraine attack, or after 6 weeks one attack, you can treat it with simple pill and you don't need to go to.
Right, okay. So, that's really, really important advice that Dr. Husnain is giving you, that instead of suffering from the migraine and that, adapt those things in your lifestyle changes. So we'll be back with more. Don't change the channel. Bye-bye. Okay, welcome back to the program. We're talking about neurology, neurological disorders, and Dr. Husnain, now let's talk about epilepsy. Who are the people? I mean, is this something you're born with, or can it happen at any time of your life? And what is the management?
Yeah, epilepsy is another very important neurological disorder that can affect the people at any age. We are seeing patients who are infant, children, young people, and people at the age of 80 even they are having epilepsy. So epilepsy have different types and different reasons. For example, if people have epilepsy or seizure disorder at the age of maybe less than 30 years of age, or maybe 15, 14, or people who are having epilepsy at the childhood, it's usually it is not dangerous. It's called idiopathic epilepsy or primary epilepsy. It is 100% treatable, and because if we do in all these patients any imaging study like MRI and CT scan, and mostly we couldn't find anything like a stroke or any other tumor or any other bleeding inside the brain or any other degeneration in the brain. So in these, it's very easy to treat epilepsy. And if these people go to a proper neurophysician or physician who is expert in managing epilepsy with proper titration of medication and proper selection of medication, they can be cured. And there is a certain period of time where they have to continue these anti-epileptic medication with full schedule, and very regularly they have to take and follow this schedule, and that they are treatable. Right. Yes, the patient who are having epilepsy at the age of 70, 80 years of age, secondary to some stroke, maybe they have some bleeding inside the brain or tumor inside the brain or some other infection. In that cases, it's difficult to treat and you need to continue medication for lifelong.
Okay.
But in those cases where you have certain reason in the brain, okay, and that is called structural epilepsy or secondary epilepsy. Okay. But primary epilepsy or in young age, most of the cases they are very treatable and 100% cure is there.
100% cure. Okay.
Nowadays, in addition to medication, because nowadays they are very good category of medication that are very safe, less side effect, and day by day you are seeing the new medication they are coming in market. In addition to medication, we have a lot of other options. Like it's like one is like you can say vagal nerve stimulation. That is another technique, semi-surgical technique that is like pacemaker. You can put pacemaker in the heart and connect one wire to the one of the vessel in the neck that is connecting to the brain, and that's called vagal nerve, and that is very effective to control the seizure. But it is used in those patients who are very resistant to control epilepsy, even with medication. If you have tried many medications, still patient is having seizure, so you can go that option. Okay. And that option is available, I think, in Pakistan, maybe only in Karachi, or nobody else is doing in Pakistan, but world is there. In addition to that, epilepsy surgery is available in the world. There are very good center in the world. They are doing epilepsy surgery, and again, the epilepsy surgery for those patients. When you have tried full medication, multiple medication, still patient is having seizure, and you have tried all others, patient is not going to revert, and with the passage of time he is having that seizure. So that patient on and very strict criteria, not all the patient even good for the surgery. You have to do specific imaging, and if you find some focus in the brain that is responsible for creating that epileptic attack, so then you should go for the surgery, and that is treatable.
Okay. When we're talking about seizures, are there specific triggers that can?
Yes, again, the other specific triggers are there. Lack of sleep, again, is very important.
That seems to be coming up again and again, you know?
Exactly. Lack of sleep is one of the major trigger in epilepsy. Okay. In addition to that, stress, physical and mental stress, any emotional event, or if you are taking medication, you have missed even single pill, you can have. Or if you're taking very irregular medication, maybe 5 days you have taken medication, next 2 days you have forgot medication, or a weekend you are not taking medication. Sorry. Or other, for example, you're not following doctor schedule, you're taking under dosage. So these are the trigger factor for epileptic attack. In addition to that, like any flu, any injury, or any fever or any infection, and some, especially in children, the patient can have a seizure.
Okay.
If they are epileptic, they are controlled, but any flu, any injury or any fever, that can cause epilepsy.
Okay, so for parents with young children, even a baby or very young children, what are the symptoms that they have to look out for? Is there anything that can indicate that a child may be developing epilepsy, or is it just the actual seizure that?
Yeah, not in all patients, because classic epileptic attack that patient is having, they should know that as the jerking on one side or whole side of the body, unconsciousness, uprolling of the eye, stiffness in the body, and their shaking movement, and these are the classical symptom of the epilepsy. And usually these patients, if you look at this one, they usually cut their tongue, and there is a frothing or bleeding from the mouth. And in addition to that, they can there is incontinence, that they can pass urine or stool during that event. These are the important feature. If these are there, or a combination of few symptoms is there, it means patient is having a real epilepsy. Not in all patients, but in few patients, usually they have some, it's called aura. That is few symptoms that before epilepsy. For example, abnormal sensation, any abnormal smell. You will see the abnormal movement around your face, and patient will start feeling any numbness, tingling sensation, or paresthesia in the body, or epigastric upset, or maybe vertigo. These are the symptoms. Some patients usually they feel that I'm going to having this attack. So usually if they are staining, they can sit down and they can call their family member that I'm going to have this attack.
Okay.
But this is for those patients who are grown up and who knows about this thing, that these are the symptoms. But and I think if children are very small, so for parents, they should try to get this, whether before these symptoms patient is having these or baby is having these symptoms, so they can have an idea. So, but adult can tell us that this patient,
they're feeling a seizure coming on. Okay, an important question here. You witness somebody having a seizure. Many people get scared. They don't know what to do. What should a person
this
do?
is very important. I think in our society there are very bad practices are there in society. They are putting many like spoon in the face or something, like trying to control that seizure. So it should not be done at all.
Okay.
If the patient is having seizure, so don't try to hold his arm or leg, because he might injure himself or all. It is better to just take care of his, that if something is dangerous around his legs or arm, just remove them and try to convert the side, and he should be on the lateral side position.
Right.
And face should be down, so that he should not aspirate any water or any vomiting. And there is another bad practice is there, that if patient is having this one, everybody try to put water in the mouth. This is totally life-threatening, and it can take the life of patient, suffocate, choking, and might have aspiration pneumonia. Mostly patients develop aspiration pneumonia, so it should be stopped at all. Should not do anything, should not put any water, any spoon, or any other plastic material inside the mouth. So let him shake. Let him shake. Just you have to change the position to the lateral side, so that all vomiting, all bleeding, or just one frothing should come out. He should not aspirate, and just give him 5 minutes. Most of the patients within 5 minutes they should complete that cycle of shaking, and then usually after that they will calm down and still again don't put anything in the mouth. Just try to give time for half an hour. Most of the patients usually they come and become gradually they will get their conscious level.
So if somebody's sitting down and they have a seizure, it's best to lie them
better
down.
Lie down on side posture. On side position. Just only this you have to do it. And if something is surrounding, like any iron or something other is there,
remove
that one, so that he should not. Because and don't try to stop the shaking.
Right, you have to let them.
That you damage the maybe bone or muscle. So it will because it's painful for the patient as well.
Right. So very important points there that Dr. Husnain is giving. If you see somebody who's having a seizure due to epilepsy, put them on their side, remove any harmful objects, and make sure you're not putting anything into their mouth, because that can actually choke them. So that's very, very important there. Okay, now we're going to move on to Parkinson's disease. Let's have a bit of time, because unfortunately we're running out of time in the program. There's many things to cover. What exactly is it?
Parkinson's disease is chronic, and it's a neurodegenerative disorder. Its nature is totally different from stroke, from epilepsy, from headache, from migraine. It's a category of neurodegenerative, that is, there's no 100% cure, and with the passage of time, even with maximum management, this disease will progress with the passage of time. It is considered as a disease of the old people.
Okay.
The common age of onset is around 60 years of age, but now we are seeing patient very early. I've seen patients with 30 years of age who are having young onset Parkinson disease. Parkinson disease has certain, it's a clinical diagnosis. You don't need any laboratory test to diagnose that disease. It's like, it's a clinical diagnosis. The patient will develop tremor or shaking on one side of the body, followed by if you will see that there's a rigidity in the leg and arm, and slow movement.
Okay.
If you look at the face of this one Parkinson disease patient, you will see that it's an expressionless face. It's a mask-like face. Okay. They will be shaking hand on one side. There will be difficulty in walking. So difficulty in walking, tremor, rigidity, and slow movement. These are the very important symptom of Parkinson disease patient. And usually they start from one side of the body, but with the passage of time, it can involve other side of the body if you will not start medication earlier.
The treatment is medication?
Again, the medicine are available, and then other procedures are there. Injectable medication are there in market, and then again the surgery for the very rare cases, for very resistant cases. But most of the cases with the Parkinson disease, they are being managed by the medication. Again, it's very tricky. This is in addition
you have to make sure you're taking
very tricky, because medication and timing of medication for Parkinson disease
is important.
In a neurophysician can only manage, or the physician who is expert in managing Parkinson disease with certain medication, he can manage. Otherwise, it's very tricky. If you certain increase or decrease without making any schedule, and patient will be having the side effect, or patient will start improving this one.
Right.
And in addition to medication, there are many other things that you can do for the Parkinson disease patient. For example, physical activity is very important. Okay, so you have to take care of ask the patient to have active lifestyle. If he is able to go for jogging, is having any swimming activity, because he should be very active. If he is bedbound at home sitting all the time, he will go down very fast as compared to those patients who have very active lifestyle and always going outside.
They're going to need a lot of care and management. That will make a difference to their well-being. Okay. One thing I wanted to ask you is about, coming to a different topic here, is memory. We find that, when you talk to people, majority of people will say, oh, I can't remember anything. I can't even remember what happened yesterday, and things are just so clouded. I can't remember this, events. Even very young people. You speak to them and they'll just say, and then you ask them, what's happened to your memory? What's going on? Is it just multitasking, too much going on at the same time?
Actually, memory or dementia, it's a very wide field, and it depends upon there are many reasons behind that one. If, for example, young patients who are having this issue of memory, especially the recent memory loss, because most of the people, as you mentioned, that they are complaining about this memory loss. Usually we have to look for the reason why they are having the memory loss. Okay, there are many there's no as such a reason that we can find in Alzheimer's disease patient or patient who are 80-year-old. They have different reasons. They have true memory loss. But here in young patient, it's not true memory loss. Basically, your brain is so much overworked, overstressed. Okay, because you cannot process 5-6 things together in your brain. If you're working from morning to evening, you are multitasking. Okay, your brain is having always 5 to 6 tasks in the brain, so you will forget daily activity. Okay, you will forget daily activity, and it will decrease your quality of life and daily activity. Still, many people are coming that I'm unable to memorize, and students are coming there. Okay, so you'll see that those patients who are overworked, overstressed,
and sleep must be a factor.
Sleep must be affected. Sleep is again one of the big issue.
Okay. So, Dr. Sen, tell us, what are the tips for someone who has an overworked brain, somebody who is constantly is a worrier, is an overthinker? What are your tips for them?
First of all, he should look at the lifestyle and try to find out a way how can he reduce his like physical or mental stress. For example, if his job is like from morning to evening, and he's supposed to do work from morning to evening, he should give breaks in between.
Okay.
very important. Like at 12 o'clock, after 1 to 2 hours, you should break half an hour. Then if he's working in front of computer screen continuously, like IT worker or something, very frequently should give breaks in between and should have some maybe 5 to 10 minute break, should stop all these work, and this is one of the things that you can give. Another thing is that physical exercises are very important, that in the evening should go for the jogging after the work, or any other yoga and other things that just to relax his mind and brain. That is very important. So these things, and third thing that you can do that is sleep. Again, 8 hours sleep is very important.
Okay, now we're talking about sleep again and again and again. What do we say to those people who have insomnia?
Yeah, again, insomnia, again, it's a very common topic. So people are many now, previously we were saying that insomnia is only disorder of maybe old people are overtaking. Now it's very common disorder that many people have insomnia. There are many reasons behind that. Okay, some are related to your stress, your psychological factor. Some are related to your like old people. There's some problem, like maybe restless in the pain, and there is some breathing issue. Okay, you have seen many people who are obese, like who are snoring a lot, and who have this special disorder, sleep disorder. It's very big field, sleep disorder. So the people who are very fat and cannot breathe properly, and they sleep actually, but they usually cannot sleep properly. Their brain is waking, but only physically they can sleep. So these people usually they have this sleep disorder. If you have anxiety, if you are stressed, if you have like depression, then these are also a reason for the sleep disorder, especially in young population.
Right.
Okay. And if you have diabetes and you have restlessness in the brain, paresthesias, pain in the leg, that is also responsible for the sleep disorder.
Diabetes, sorry, this gives you
People
what?
who have diabetes, who have pain, burning sensation in the legs and foot. So this is also responsible for maybe the lack of sleep as well.
Okay, right. So tell us about, how a person can sort of, because we do feel that, many people are involved with a lot of gadgets. So how much is that also making it difficult for us to sleep at night? Because if your mind is wired at that time when it's supposed to be bedtime.
Exactly. So I think this is one of the, I didn't mention this one, this is a very important reason that if you're using gadgets and all these things, so that's also responsible. They can activate your brain to such an extent that your mind is always active, remain active, and cannot have any rest. Because if you are seeing 20 out of 24 hours, 8-9 hours in the night, or 4-5 hours continuously using different gadgets, so this can activate your brain, and it's difficult for you to go to the brain. And another thing, that if you change your your pattern of sleep frequently, like sometimes you're sleeping in the daytime, sometimes you're using in evening time you're sleeping, or sometimes you're sleeping at the night time. So this will also affect the quality of your life and quality of your sleep, and your sleep will not be completed as well.
Okay. What about very young children? How much should they be sleeping? We're talking about 2-year-olds and onwards. How much sleep should they be having?
Actually,
because we see a lot. Sorry to interrupt you. We see a lot in our culture that because the parents are awake, the children are also awake with them. So, what should be their bedtime?
There, actually, if you start from the infant, they need more sleep hour. Children 2-year, 4-year-old, they need more sleep hour than you, maybe more than 12 hours. Okay, so you have seen that in infants, they are sleeping the whole day, sometimes the whole night. They are sleeping, so their sleeping requirement is more than the adult people. So even children, I think we should recommend this one more than even 10 hours to 12 hours they are sleeping. That's okay. But like if your children are more than 12 years of age or 15, like adolescent, so for there, when you grow up gradually, your need for the sleeping is reduced gradually. And then again, you come to that age, that 8 to 10 hours for adult.
Okay.
6 to 8 hours. Sorry, 6 to 8 hours. But for the children, for 2-year-old, even 10 to 12 hours, that is okay. So don't try to keep them awake. So for children, definitely, it's with the passage of time, your
It's a
sleep
gradual
hour reduce.
reduction.
But the children, yes, they need more hour. If they sleep, because the childhood migraine is a very common,
Really?
very common childhood migraine. And one of the things is that maybe they sleep usually 6 to 8 hours. They are sleeping with the parents, waking up with parents, and in the evening they are not sleeping. So for children, you give
Right.
them 2 to 3 hours extra than you.
Okay. Thank you very much, Dr. Husnain, for joining us here today with really, really valuable advice that you've been giving us on this subject.
Thank you very much.
Okay, and with that, we come to the end of today's program. Lots and lots of advice. I've found so many things that was so helpful. So, do take whatever our experts are saying here on the show, do take them seriously and incorporate them into your lifestyle, because what can be better than to have the blessing of good health? So until next week, stay happy, stay healthy, bye-bye.